We have Daniel Levner, who's a co-founder of a remarkable company called Diagnostics. Sight set out to make a dream which others had talked about actually come true. How could you take 2 drops of blood from a single pinprick and essentially turn it into a clinically valid complete blood count? Some people didn't believe it was possible. Sight has done it. I've tried it myself, and now the FDA has cleared it. So Daniel, take us away.
Thank you, John. It's a pleasure to be here. As John mentioned, my name is Daniel Levner. I'm one of the co-founders of Sight Diagnostics. The next slide, please. Sight is an Israeli company founded in Jerusalem and Tel Aviv around 2011. Frankly, our story starts as a technology story. We're really excited about the advances in AI, and we said, surely these advances have a role to play in medicine, specifically in diagnostic medicine. But as the years progressed, we actually got really excited about the purpose, the mission of our technology, which is to provide fast, accurate, and low pain testing. And specifically what that means is that today, very often diagnostic testing takes several days to get your results. I know that's my experience in my daily medical, not daily, hopefully, in my medical use. And what we've been able to do is actually to turn some tests into tests that give you results in minutes instead of days. We actually started with a test for malaria. That's the instrument, that's still actually the previous slide. We started with a test for malaria that we launched in 2014. And we've been able to get this test, this instrument, into 25 different countries worldwide. We sold more than 1 million tests for the system. It was a great technological success and addressed a really important medical need. But we're also interested in a need that affects even a broader community, which is why in 2018, we launched our second instrument you're seeing on the right. It's called OLO, and it provides a very specific blood test that I'll tell you about in a minute called the complete blood count. And as John mentioned, this test has actually recently been approved by the FDA through a 510(k) clearance. Next slide, please. So what is a complete blood count? I'm sure you've all seen it. We've all had it done at least once in our life. It's a test that measures many different parameters, at least 19 to 21 different parameters in blood, including the counts of different types of cells, including red blood cells, several types of white blood cells, platelets, and so on. Now, it's only specific for certain diseases in terms of what it's able to diagnose, but it is a first line of questioning for doctors very often. It's a first question to determine things like infection, bacterial versus viral, cancers. It is diagnostic for anemia, and so on. So it's a very broad test. There's 4 billion of them conducted yearly in the world and 450 in the US alone. Next slide, please. Now, you may ask, okay, how does this relate to COVID-19? Well, our system, CBC, doesn't in itself diagnose a COVID-19 infection, but what you're seeing in the diagram on the slide is that the test is actually being used to triage patients who come in with COVID-19. And what that means is really to assess the severity of the disease, to determine whether a patient needs to be hospitalized, for example, whether they need to enter the ICU, and so on. So it's not the test that you've been hearing about in the news that is in such high demand, but it's actually the next level of testing that assesses what to do with a particular patient once they've been shown positive. Now, on this slide, you're seeing a comparison between conventional equipment and our new solution, right? So currently, you can get a complete blood count done, but usually that involves sending the blood to a central laboratory. The central laboratory has this large piece of equipment, hundreds of thousands of dollars for sure, that really only makes sense to put in these large hospitals or large laboratories. And even versions of that large equipment that have been miniaturized, other people try to miniaturize it, they always have drawbacks, including requiring cleaning and calibration and so on. Our system, again, you're seeing on the right, is designed around these single-use cartridges. It doesn't really require any calibration or cleaning. And as John mentioned, we're the first to be able to do this kind of testing from small finger prick samples. So literally 2 drops of blood are enough for us to get the same result, actually with the same accuracy as you get from that traditional large equipment. Next slide, please. So this brings me to why you would want to use this for COVID-19 specifically. And one example is actually in practice right now at Sheba Tel Somer Hospital, we place one of our instruments in their isolation units. The isolation units are those units where they're airtight, they let in the COVID patients, but they really control what goes in and out. Prior to our technology, they had to take the blood tubes out and bring them back to the central lab equipment. And of course, that requires cleaning and a lot of care to make sure that these blood samples don't carry the infection out of the isolation area and infect other individuals along the way. Our instrument is small enough that you can just put it within the isolation unit. All the testing can be done right there on the spot without moving any blood samples. Next slide, please. Now, there's another use that's actually emerged, which is maybe a little less obvious. This is a collaboration we have with Ichilov Hospital in Tel Aviv, and originally set forward with the help of the IDF. And the idea here actually isn't to target the COVID-19 patients themselves, but actually the collateral damage, which is the individuals who should have been going to the hospital for all sorts of other testing. In this case, cancer patients, chemotherapy patients, who because of the quarantine and because the hospitals are overrun, aren't able to go into the hospital for regular testing. So the idea is to bring the testing to the patient's home. And what we're doing in this collaboration is actually taking our Ola instrument and installing it within a mobile diagnostic units, mobile bands that will be able to service within Israel this chemotherapy population. Next slide, please. Now, last but not least, a really important question now in the treatment of COVID-19 is the assessment of who's high risk and who isn't, because we keep hearing about patients who are asymptomatic or actually have a minor disease versus ones at the opposite end of the spectrum who are in the ICU and are a serious risk. We don't have an answer here yet, but one of the interesting things about our technology is that we call it digitized blood. We can take a blood sample and turn it into a large collection of digital images that represent that that blood sample, and we can run various research studies on that. So we can actually look for indicators within that sample that may indicate the prognosis of the disease. Again, this is R&D, but we're seeing some interesting results.